you're looking at like certain test questions, you're gonna have decreased cardiac output. But I think the dilated, the hypertrophic, and restricted, it will help you define which myopathy it is, because it's kind of right in the name. But they're gonna have fatigue, they're gonna have shortness of breath, weaknesses, heart failure. So they're all gonna have those same symptoms. And because of that, they're gonna have the same medications. And same with your valve and your infective disorders. They're all gonna have the same symptoms, left-sided heart failure, and you're gonna have the same medications, which is kind of nice, so just loop it all together. When it gets to cardiomyopathy, they say there's primary and secondary causes. Usually the secondary is from any disease process. But signs and symptoms, like I said, same as heart failure. So you're gonna have left-sided heart failure, or right and left-sided heart failure problems. Management, heart failure meds. I'm not gonna go into all of them just because they're gonna be the same, because we wanna decrease that workload of the heart, and that's what heart failure meds do, so it's a lot of the same. Anticoagulants, so we don't have any blood clots. ICD, maybe they need help pacing or defibrillator. So if their heart failure is so bad, well, here's some therapeutic effects first of all. EKG, echo, TEE. We're gonna look at all areas of the heart, electrically and visually. You can go in and do an ablation, take some of that area of the heart. You can do a surgery where you remove that hypertrophic tissue. If they have an artificial heart, or this is more of a heart pump, they need a heart transplant, they'll have a pump. They carry a little pack. We've had 3, I don't know how many, there are a couple of people in the community that have this. You're not gonna feel a pulse, and you won't have a blood pressure with these people. So they'll be sleeping, and you think that they're dead because you can't feel anything. But, go ahead. The battery pump is doing their heart pumping, yeah. So, yeah, and so, what?
They don't have a pulse?
No. This is called just waiting for a heart transplant, the pump. Yeah. So you're going to have, so like I said, EMTs, usually EMTs in our emergency room we know who these people are. The one that I know, he's got a heart transplant, so he doesn't have this anymore, he finally got a new heart. But, so we're very aware of who's in the community that has this, because we just have to be aware when they come in. But what they do with the heart transplant is they literally just kind of like unfold the heart and then suture it in.
Wow.
You need to meet certain criteria before you get this. So eligibility, what's your life expectancy? What's your lifestyle habits? Do you smoke, do you drink? So alcohol use, body weights. You're looking with a heart transplant, you're looking at blood compatibility. Usually these people, I shouldn't say it like that, but wherever their doctor is, it's like they have like 3 hours. The person that I know, it was like he had to stay in the community. It was like if he got a call, he had to be at the hospital in Columbus within 3 hours for a heart. And if he couldn't, it would have gone to the next person on the list. So the people that are waiting for a heart, I mean, and they say they can only be on this LVAD for about 3 years. And then after 3 years, they probably need to get another one. So they're at high risk for obviously heart failure because their heart is pretty much dead already. Tamponade, cardiogenic shock, and whatnot. How would we know if someone has a heart transplant? How would we know that the heart is working the way it should? What would you see? What would, just in general, what would?
Perfusion.
Perfusion, how could we see that? Oxygen goes up, blood pressure, not up, elevated. It's because at first, they're gonna keep their blood pressure a little bit low just to make sure that it's not the heart's not overworking. But looking at their blood pressure, is it tanking? Is it like 60/40 or is it 100/60? So those are, look for signs of adequate perfusion. So our valves we talked about a little bit earlier. So we have, there's usually the mitral valve and the aortic valve are the ones that get replaced the most, that have the most diseases. So you'll need to know all 5 of them. But the mitral valve, which one is that? Are we trying or buying on that one? I should go over here. I was over here, but it's over here. So mitral valve stenosis, and it's just kind of what it says is, mitral valve prolapse. That's where the leaflets are not working properly, where you can see the leaflets are coming together here, but when it's prolapsed, that leaflet is kind of ballooning into the right atrium. So because of that ballooning, you're gonna have symptoms of fatigue, shortness of breath, dizziness, or whatever. You can see the blue, because when this left ventricle contracts, it's gonna regurgitate blood into that left atrium. So where is the blood backing up to? If it's going from the left ventricle backing up to the left atrium to the lungs.
To the lungs, yeah.
See, so it just follows this pattern. Biggest thing is control the symptoms. If there's any dysrhythmias, control the dysrhythmias. But the medications are the same as your heart failure medications because we're decreasing that workload on the heart. We're gonna do the same thing with this. Mitral regurgitation, it's kind of I just explained that, where when the left ventricle contracts, blood is getting pushed back into the left atrium. So the same thing, it's gonna get backed up into the lungs, you're gonna have left heart failure symptoms and left heart failure medications. One thing that I did learn when I was kind of going through all this years ago is I forgot how rheumatic fever is a big cause for a lot of our disease, our heart infections and our valve disorders. Because you can see that rheumatic heart disease, mitral valve prolapse has regurgitation, age, that can happen, endocarditis, we'll get to that in a bit, and then just the malfunction of the papillary muscles, which is like the prolapsing of the valves. But those are causes of mitral valve regurgitation. I don't think there's anything in there that's different than what you've already seen. Like I said, those symptoms reflect on the heart failure medications and signs and symptoms. Valve stenosis, mitral valve stenosis, that means that mitral valve is not opening or closing, it's narrowing. So it's really hard for blood to get from the left atrium to the left ventricle. So it's not that the blood is getting backed up from the left ventricle to the left atrium. It's actually not getting to that left atrium or the left ventricle. So it's again backing up into the lungs. Again, rheumatic endocarditis, strep throat complications. So always treat your strep throat. Don't let them go long because that is a risk factor for mitral stenosis. Anticoagulants, if blood is starting to coagulate and develop blood clots, they could, you could have anticoagulants with this also. Now we're at aortic regurgitation. So where's that valve? So it's your aortic valve. This is the valve that opens to allow blood get into the rest of your body. So if the aortic valve is regurgitating, where is that blood getting backed up to? The left ventricle, which gets backed up to the left atrium, which gets backed up to the lungs.
So everything just goes back to the lungs?
Pretty much. Unless it's a right-sided problem, then it gets backed up to the body. But most of our valves, because there's such a high pressure on the mitral valve and the aortic valve, that those are the ones that are why they're affected the most. But like I said, just follow that bloodline or blood supply. Where is it getting backed up to? And that will help you with your symptoms. Infective endocarditis, any kind of congenital abnormalities. Any kind of heart failure. Prevention, rheumatic fever. Rheumatic fever and strep are in a lot of these because of the bacteria that it builds up on. And then aortic valve stenosis. So this is where that aortic valve is narrowed. It's not allowing blood from the left ventricle to the aorta. So again, it just gets backed up to the left lungs. So this area is stenosed, so when it contracts, not a lot of blood is getting into the aorta. So just when you get these test questions, just visualize what's happening, where is the blood getting backed up to. Don't freak out. Management, educate, prevention. So prevent strep throat. You have a sore throat, go get it checked out. If you have a history, family history of anything, cardiac disease, treatment. So treatment revolves around doing valve replacements, or they can actually go in and take some calcifications from the valves itself. So here's complications, bleeding, a blood clot can occur during the procedure. But here's the direct open commissary. This is where they go in if it's stenosed, and they can go in and kind of open up the leaflets here. Here's the leaflets are damaged here. They can go in and actually suture those leaflets to repair the leaflets. And then there's valve replacements also, but there's certain different kinds of valve replacements. So mechanical, then we can use tissues from other animals and put those in. Pigs, cows.
Oh.
I know. Cows used to be the big one, but now they're getting all the mechanical ones. But discharge teaching, when you are leaving with, whether it's mechanical or other tissue, this tissue is not yours. It's abnormal in our body, so our body is going to want to fight it off, and when we fight stuff, it's going to coagulate with blood. So they're on Coumadin, they're on anticoagulants for mechanical valve, because blood clots can start to adhere to the mechanical portion of it. Another thing that's at high risk is bacteria with any kind of valve procedures. So they want you to notify all your doctors, dentists, because your mouth and your gums are highly vascular. They want to decrease any kind of bacteria when you're having dental procedures. So they'll ask, ensure that you take like a prophylactic antibiotic before you have any dental procedures. Just to decrease your risk of having any kind of valve issues. Prevent endocarditis. You'll have scheduled echoes a couple of times just to see how that valve is working. And like I said, inform all the healthcare providers. Then when we get into the inflammation disorders, do I want to go on? Okay. Pericarditis, myocarditis, or rheumatic endocarditis, and infective endocarditis. Again, risk factors are the same as heart failure. Medications, usually they're all on high potent antibiotics for long term, so this patient might be going home with a PICC line because they're gonna get like a couple of weeks of antibiotics. They don't need to be in the hospital for it. But promote health, proper health, risk factors, congenital, maybe there's a congenital malformation, IV substance use, heart valve replacement, immunosuppression, rheumatic fever, and strep. So the first one is endocarditis, or rheumatic endocarditis. So this is inflammation to the endocardium of the heart, go figure. But fever, pain, but prevention is usually check if you have strep throat, prevent that, antibiotic use. These patients with rheumatic endocarditis, they're on penicillin, erythromycin, maybe for 10 days. Not a lot of people, but if you had susceptibilities, I know that, not rheumatic endocarditis, but one of the COVID vaccines, some people kind of were thrown into infective endocarditis with their heart, with the COVID vaccine. So here's infective endocarditis. This is a staph infection or a fungi within the heart. And that's what I see. When you see an echo and if someone has this, I've seen one where you could see the leaflets going in and out, and you can see the fungus going in and out with the leaflets. And I'm like, oh boy, if that breaks off, we're in big trouble. But it was crazy how you could see the little fungus traveling with the valves. But this is usually high probability with IV drug use. So they're gonna have medication, 2 to 6 weeks of antibiotic use. We had a patient once in ICU, this was crazy. He had a PICC line and he was going to the bathroom. If anyone's been in there, they have a toilet in their room, and we saw the curtains moving, and we're like, what is he doing? Well, he got a syringe, an empty saline syringe, and he had a Vicodin, or I don't know, a narcotic. He chewed it up, and he was spitting it. He spit it into the syringe, and he was shaking it up, and he was gonna put it through his PICC line. And we're just like, what in God's name are you thinking? Wow. We told the doctor came in and just ripped it right out. He's like, now you don't have a PICC line. But yeah, you gotta be careful with what you bring in a room and what you leave now they lock everything up. But, it was interesting, but he had infective endocarditis. Go figure, he was putting that stuff with his saliva, which has probably a lot of bacteria, right into his bloodstream. Tattoos, dental piercings, they say that those are all risk factors. Positive blood cultures, you can do positive blood cultures. Myocarditis, this is just inflammation of the myocardium. That's why I think you guys will figure out what it is when you read it. I'm not too concerned about it, but left-sided heart failure, and heart failure medications. Immunizations you can have for this, but just to decrease your risk factors. And then the last one, I think, is pericarditis. So this is a sac that covers your heart. That becomes inflamed. There's something that's called a pericardial inspiration, a friction rub. That's what I'm thinking of, a friction rub. Usually if someone's sitting up straight, they might have pain when they're breathing, but if they lean over, it puts less pressure on the heart so that they wouldn't have that friction rub. You have a friction rub with your lungs, but you can usually hear it but with your heart, it's more painful. Because that inflammation, that heart is in that lining that's pretty inflamed. You could do blood cultures, I'm not gonna go through all them. Cardiac enzymes, your troponin, CKMB, you guys already know that. Throat cultures. I think you're good. And the last one, so complication of all this is cardiac tamponade. That's where fluid is building up around the heart, between the pericardium and the heart muscle. We do have a little bit of fluid that is in there that allows a normal or a functional contraction, a fluid contraction. But if too much fluid is building up in that inside the pericardium and against the heart muscle, your heart is not going to be able to contract. So that's why you're going to have decreased cardiac output with this. You might have blood backing up into jugular vein distension. Muffled heart sounds, because you're listening to the heart, but you're listening to the heart through fluid, so that's why you might have muffled heart sounds. This paradoxal pulse is when you inspire, systolically, the blood pressure decreases by 10, because when you inflate your lungs, it's putting pressure on the heart, so you're gonna have decreased cardiac output. And then when you expire, your lungs deflate, and then the heart is working pretty well. Well, I shouldn't say well, better. But you'll have this paradoxal pulses, where it's just a change in blood pressures with inspiration and expiration. You guys got it? Y'all ready for test?
No.
All right, let's see what I got here. Let's do some. I don't have anything. Let's do. Yeah. Let's do, okay, everyone take a piece of paper and write out 2 test questions. You can do it in small groups. Write out some test questions. Whatever you want to be, they can be selected on the fly, they could be whatever. On shock and cardiac. And we'll see if they're good.
Hi, can I join you guys?
Sure.
I'm tired. I'm so tired.
2 random.
So sorry.
Make up 2 random. Oh, well, that's not this. Sorry.
Oh no, am I caught on?